And welcome back this morning. Earlier, we talked about North Carolina budgets. This week, the Congressional Budget Office released its latest report on the Republican-backed health care plan that would repeal and replace Obamacare. According to their projections, the bill would leave 23 million people without insurance over the next 10 years. The plan would cut the deficit by more than $100 billion. The bill is now in the Senate, with the Republicans currently writing their own version of the health care bill. We're joined now by Congressman Pittenger, who represents North Carolina's 9th District. Congressman, you voted to pass this bill. What are your thoughts now with the CBO's analysis on this and where things stand today?
Certainly, that's a good question. I think let's take the CBO in full context. Their analysis, frankly, have not been on mark. In the past, they predicted 18 million people would sign up for the exchanges. Actually, 12 million people signed up. They were not able to understand the real cost of Medicaid expansion. They were about 62% short on that. So in reality, it's difficult for them to get a full in-depth picture. What they did say very clearly is, yes, that it would reduce the deficits by $119 billion over 10 years, and it would significantly reduce premiums. And that's what we're all about.
When we talk about how this affects people, we want to talk about constituents and, how are they taking to some of these changes? Because that's what really matters. The people back at home here in North Carolina, how are they reacting to this?
Well, absolutely. They realize that their own insurance is threatened. Major carriers, Humana, Aetna, United, have fully pulled out of the market. Blue Cross Blue Shield has threatened to pull out, even here in North Carolina. In Missouri and Kansas, just this last week, they fully pulled out. So it is at a pace, at a death spiral on the account of many insurers. And so what we're doing right now is creating a market-driven health care that will provide cost-effective insurance for the average American person. Just since 2013, the Health and Human Service Department gave numbers that the cost for insurance in North Carolina has increased by $422 a month. That's $5,000 a year. That's big bucks for a family with $50,000 of income. So what we're doing right now is providing insurance that will be accessible to the American people.
Let's talk about redistricting a bit. The Supreme Court struck down 2 North Carolina congressional districts because of the fact that they played too large of a role in the creation. The justices say too many African Americans were put in the districts used in the 2012 and 2014 districts. The state redrew the maps last year during those races, but challenges have already been filed against those redistricting plans as well. Your thoughts on that? Were you surprised by the ruling?
I was a bit surprised, but I'm comfortable with whatever the determination is. I think they went against some of the previous court rulings and the need to understand why that the maps that were drawn by the legislature, approved by the North Carolina Supreme Court, approved by the Attorney General's office and Justice Department in the U.S. federal office, that they weren't acceptable. But nonetheless, I'm happy to represent the good people of the 9th District.
With just a couple of minutes left, I do want to shift gears just a moment to the Trump administration. This is Donald Trump's first trip overseas right now. What are your thoughts on how he did so far, his success, some problems he ran into? What are your thoughts on that?
Absolutely remarkable. To assemble 50 Arab countries together. Most had said, well, the Muslim people don't like Donald Trump. On the contrary, they treated him with great dignity and respect, and he unified particularly the Sunni Arab nations to combat Islamic terrorism. This is so critical. He properly went to NATO and said, we pay 4% of our GDP. We're just asking you to pay 2%. And yet most of you are not doing that. So I think he's very clear. And the thing that has been lacking for the last 8 years is a clear message, a clear mission, a clear focus on what needs to be done. Much like Ronald Reagan, he united the world against communism. This president is remarkably doing a tremendous job working with Israelis, with the Arabs, to combat Islamic terrorists.
Congressman, thank you very much for your time this morning. I appreciate you coming on. And folks, we'll be back right after this short break.